All right, we're just going to set it up, share the live stream. Then we're going to go through questions that people posted on the videos, starting with the questions on root canals. Give me a couple of minutes here to share this on the platforms so people know we are live. Share. Just getting this all shared. All this takes a little bit of work. That is shared. Posted for you guys. Take a picture. There you go. All right. Let's see if we can now go to the questions. I'm not sure if the comments work, but if you're interested in leaving a comment in the chat, I will try to answer your question directly. But we're going to go to the first video, and I'm going to try to switch to my screen here. Let's see. Audio, 1, 2, 3. So yeah, it doesn't look like the audio works if I'm on the wrong screen. So you're just going to have to take my word for it. So I'm going to go to the video that I just showed you guys. It's called Before Getting a Root Canal Treatment, Watch This. We have a lot of questions in that section, and I'm going to read the question, and then I'm going to go back to the other screen and give you an answer. Now, Tony said, I'm 63 and I have 3 missing molars with, ironically, were all root canals in my youthful years. Please avoid root canals if at all possible. I agree, Tony. Avoid them at all possible costs, and that involves seeing a biological dentist, of course, somebody who's going to teach you the prevention. A root canal treatment is the last resort, okay? the last thing we can do as dentists means that everything else we could have done failed. So if we need a root canal, dentistry has failed you. And unfortunately, there isn't very many other options. Now we go on. Yes, my root canal was just done earlier. Sorry, but you still have options. Most informative content. Thank you. You're welcome. Never had a dentist explain anything like this. You're welcome. Let's see. Okay, it says, I've had the worst dental work over the last 3 years. I'm afraid to even go back. She works on teeth, and then the teeth wind up becoming a bigger issue. I'm miserable. My left side of my face is no longer symmetrical to my right. Sad face. Ashley. Okay, Ashley, let's address that. That is a good question. So, Ashley posted a comment about having a lot of dentistry done, and unfortunately, she noticed that her face is no longer symmetrical, meaning her eyes are probably not symmetrical, and that follows then down to the chin. The reality of that is, and I'm going to switch over here so I can make sure that you guys can hear me. The reality of that is that, let's see if the live is still working. I think it is still working. I'm not a techno wizard, so hopefully you guys can hear me, and there's really no way to tell me if you can hear me, so that is okay. Okay, we're going to assume that you guys can hear me. All right, so because of the dentistry being made in her face, usually somebody chooses to chew more on one side or the other. And discomfort will do that, right? If your side hurts, this is mirror image, but this is my left side. If your left side is hurting because you had a lot of dentistry done on the left side, you're not going to chew on that side. You're going to be chewing more on the right side. So if you do that for a very long period of time, the muscles on the right side become stronger. There is a bone here called the zygomatic arch. You can feel it. It's a pretty darn big bone. And then there's the mandible, or the bottom part of your lower jaw, also a very strong bone. The muscles connect from here to here and they pull, okay? There's a muscle on the outside and there's a muscle on the inside, like a sling that goes around your mandible all the way up here to your zygomatic arch. So as you're chewing and this muscle gets stronger and stronger, it's going to pull this bone down and the mandible up a little bit. What does that mean? That means your eyeball, your eye socket actually drops down a little bit. When you look at people, they may start off perfectly symmetrical with their eyes, like right around there. But then as they start chewing more on one side or another, let's say the right side, which is my right here, the eye is going to start dropping and you're going to start looking more asymmetrical. And you've seen people, they're either like this or like this. That, in my opinion, is mainly due to how they chew for a very long period of time. And dentistry, of course, is a contributing factor. So what I tell people to do, well, just like common sense, if you're chewing only on one side or you're only building one muscle, that muscle is going to grow. That muscle is going to pull on your eye socket and it's going to pull your eyeball down. Before you know it, you're asymmetrical. How do you fix it? You chew on the other side. Yeah, it's going to take a little bit of time, but you chew on the other side, and suddenly that side is going to lift. And before you know it, you're going to rebalance your face, for lack of a better term. Once you start getting close to being balanced again, chew on both sides. Super critical. Chew on both sides. So to prevent this issue, chew on both sides starting immediately. Don't chew on one side or the other. And the symmetry of your face will stay the same. There you go. That answers that question. Let's go back and read the next question, which would be, let's see, da-da-da, watch me play Nintendo. Yep. Thank you for commenting. I have kids, and yeah, we've been through all that. This is no joke. My father suddenly developed rheumatoid arthritis, swollen joints in 2012 as a result of an infected tooth from a root canal done decades earlier. None of the doctors properly diagnosed the cause of the problem, the root cause, despite being aware of signs of an infection. He eventually figured the problem out, extracted the tooth, and the rheumatoid arthritis went away completely, although the length of the infection may have caused some lasting effects. True. When he told his rheumatoid doctor, she seemed completely uninterested and unwilling to research the issue. Very, very common. Thank you for that comment. Appreciate that. I had a patient yesterday, and I asked her to leave a review online to discuss this because it goes right with this. I told her, hey, can you share your story with a review on our website on Google? So if she did, it's going to be under Saddle Peak Dental in Bozeman, Montana, and you should be able to read the review. Anyway, she said she's had crepitus or crunchy rheumatoid arthritis kind of like feeling and sounds in her knee for years. I'm even thinking she said decades, but don't quote me on that. And we removed 2 teeth, okay? We removed 2 infected root canal teeth. Can't tell you which ones, but it was pretty clear that these were bad infected root canal teeth. And I saw her yesterday for her post-op. It's been 3 months. And she said her knee almost immediately started to feel better and she no longer has any crepitus. No more pain when she moves her knee. No more funny crunchy sounds when she moves her knee. And this has been many years. And it's clearly linked to something we did, which was remove the infections or the root canal teeth. I don't know what else I can say. This is life changing for people. If you have a knee that's bad, rheumatoid arthritis, crepitus, immune disease, something like that in your knee, and you only feel it in your knee, I promise you it is not just your knee, it's your entire body, okay? All your joints are inflamed, everything is irritated, chronic inflammation. The fact that her knee now feels perfect, which was the pinnacle of the discomfort, to me means that she's going to have a dramatic increase in health. The immune system now no longer is fighting itself. It doesn't have any dead organs in the body that cannot be treated, that the body can't remove, that the body can't treat. And so she's going to get better. And she did. Life changing, right? Life changing. So yeah, thank you for that comment. Watch me play Nintendo. I appreciate that. You're exactly right on with that. Next one. Da 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 da. Set a question. See, so an endodontist. No, would have to get extracted. Saved. There's a lot of questions in here from patients or people who have infected teeth or aching teeth or deep cavities or cracks, asking if they could save the tooth. Of course, we always really want to save the tooth. That is the goal. Once the tooth is dead, though, like truly dead, we cannot save the tooth. Then your only options are a root canal or removing the tooth. So a lot of these comments, I don't want to give false hope. I just want to let you know that prevention is key. When it's irritated or affected, meaning the root is not dead yet, it's thinking about dying, there is things we can do to reverse it, okay, to prevent it from dying most of the time. And that requires a biological dentist or a dentist that has the knowledge of how to atraumatically clean the area just above the pulp where the damage or the decay is, and then rebuild it atraumatically as well. And it's too deep for this conversation. Okay, so we go on. Simply deliver how 7 root canals. If you have 7 root canals, something majorly went wrong with your teeth. You don't just have 7 root canals. Um, that's a lot. We need to work on prevention there. I had a cold test done. Okay, here's a good question. This one was by this disciple of the King 29. I had a cold test done this week on my back molar, and it was painful in capital letters. and still hurting, taking Advil daily the past 2 months since my crown preps. Let's stop there for a second. So you had a cap done on your tooth and it's hurt immediately, and you've been taking Advil for 2 months daily, which on its own is absolutely terrible because your gut is just going to get destroyed by that. Can't do that. And it says you had a cold test done, which was extremely painful. So a cold test is when we check the tooth to see how it responds. Here's what we're looking for. We put something cold on the tooth. If it doesn't respond at all, it's dead because there's a nerve in the tooth, right? You would like to see it respond. So we put a cold test on and then we look at what type of response you get. If you get a really quick response and the response goes away again fast, that's totally normal. We want the tooth to respond and then go back to normal. If you get a really quick response and it lingers a little bit, that means the tooth is irritated, meaning it's not quite normal, it's irritated. If it takes a long time for the response to come, and then it starts to respond and it hurts or it's aching or throbbing, and then it lasts for a long period of time, that means your tooth is on that cusp of the parabola of death, meaning it's probably dying. Okay, it's probably not going to be able to go down towards the side of health. Why? It's all about inflammation. Inflammation or the expansion, right? Inflammation is expansion, immune response. Inflammation inside a tooth kills the tooth. There is no room for expansion inside the root of the tooth. There's no room for expansion below the tooth where the nerve, the artery, the vein, and the lymph system all goes in and out of the tooth. So if you get inflammation in the tooth or around the tooth or below the tooth, where everything enters the tooth, the inflammation is going to constrict the blood vessels. When there's constriction of the blood vessels, the tooth doesn't get a blood supply. If you don't get a blood supply to an organ, the organ dies. And that's throbbing. You know, like you've had a tourniquet in your arm when you give blood and you're pumping your hand and you feel the pulsating of your arm because the blood wants to get into the arm, but it's really not getting there. And your arm starts to feel funny. And if you did that for a long period of time, the arm would die because there is no blood innervation to the arm. Of course, they open it up and they take blood and it shoots out, which is great. But that's the same thing for a tooth. If the blood supply is compromised for a long period of time, it dies. It happens all the time. And so when you get inflammation from dentistry, from biting too hard on the tooth, from trauma, from decay, whatever it may be, the tooth will die. So you had a very painful, it says, cold test, which points towards it being very irritated. The fact that you are still taking Advil means that it is inflammation that's being reduced by the Advil that's helping it, but it's not getting any better. You said terrible nerve pain and aching. Aching is throbbing. That is inflammation. People keep saying get the root canal, but I want it pulled. Okay, so those are your two choices, right? At this point, it's dead, most likely. Aching, throbbing, you're not managing it with pain anymore. Either get it pulled or get a root canal. Only 38, which is young. So I keep hearing, you're too young. Yeah, you're very young. But that's not going to change. I feel young at 52. Well, and then it says, well, tell that the 20-year-old eating candy. Yes. When you eat 20 candy in your 20s, like you said, there's consequences. Candy feeds bacteria, they release acid, kills the teeth. Da 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 da. Crowds are sure what that's why I've seen loss. And then you said you wanted to send you to an endodontist. Yeah. If you do want to get a root canal, please see a specialist. An endodontist is a specialist that does root canals. General dentists don't do enough root canals to do a decent job, in my opinion, and you end up with too many immediate problems. A root canal done by an endodontist is a long-lasting temporary solution, in my opinion. Certainly a lot better than a regular dentist. It's all about money and referrals. Yeah, it seems like that at times, but no, dentists do mean well, I think. Most of us want to help, but unfortunately, there's certain rules we have to follow based on what the tooth does. If the tooth is dead, it needs a root canal. That's kind of like what you learn, right? A root canal or removal. There isn't very many other options, and most dentists do have hearts. All right, on we go. Biologic dentist wanted. Here's a question that I get a lot. Biological dentist wanted $650 just to see me in Michigan. I had good dental insurance, but not covered for biological dentist. So this is a tough one. Um, Dental insurance is a dental benefit. It's not insurance, unfortunately, and it doesn't. Dental insurance don't care what kind of dentist you are. Biological dentist, general dentist, holistic dentist, biomimetic dentist, I don't know, Superman dentist. It doesn't matter. They don't care about that. The dentist is either in network or out of network, meaning they accept insurance towards their treatment or they don't. The funny thing is that most dentists feel, not most dentists, most patients feel that private practice dentists that do not take consignment insurance or accept insurance, pretty much telling us what to do and how much to charge, um, and that the private dentists are expensive. Well, in reality, is that in my experience, most dentists who accept insurance make a ton more money than biologic dentists or private dentists because unfortunately it's more about volume and it's more about cutting costs. And private practice dentists that don't accept insurance, focus mostly on the patient, only the patient. Like I take no insurances. I don't I didn't join any organizations anymore. I don't care who they are because I only work for you. I only work for the patient. And I'm going to use everything I know to try to help you, not what somebody tells me is the standard of care, what I should do, because it's constantly changing anyway. So a biologic dentist charging $650 to do a complete exam and a workup is actually fair because we have to take 3D scans. We have to do the whole mouth probing. We have to examine every single tooth. We have to possibly cold test, analyze your results, look at your 3D scans, come up with treatment plans, sit down with you, and talk with you for a significant amount of time to try to give you your options, your true options, try to feel out what your priorities are and how to guide you towards the best solution for you, okay? That takes a tremendous amount of time, a tremendous amount of um, staff, power, equipment, things like that. And it's going to take us way more than just an hour. It's going to cost us way more than $650. And it's not a moneymaker, okay? It is expensive, absolutely. But it's not a profitable visit for dental practice. And unfortunately, yeah, that is a lot of money. But the most important visit you can have with a biologic dentist, in my opinion, is a new patient exam. Spend the time with somebody who only has your interests in mind, who has the knowledge, the background, the equipment to truly give you a plan, truly find the root cause of your challenges. What you do with that information then is up to you. But that is really the key. There's not a biologic dentist I know that will ever be able to accept insurance payments and the limitations by insurance companies because then we work for them. And we don't work for them, we work for you. All right, on we go. I was wondering if I did a good. No, that's not a question. Yep, it's true. My first problem here. Here's a long question. Here's a long question. Singalina asked a question. My first molar in the bottom teeth hurted a little bit. My dentist couldn't see any infection on the x-ray. They probably took a regular x-ray or a bite wing or a periapical x-ray, which is not diagnostic enough for a true root problem, in my opinion. You just add, in my opinion, to everything here, okay, so that nobody gets upset. And just for the algorithm, YouTube, and all those people, this is of course only for entertainment purposes. Nothing I am saying is serious, and I'm just doing it for entertainment purposes only. Okay, there you go. Disclaimer. All right, so it says now she said, but My dentist couldn't see any infection on the x-ray, but she decided to remove my old composite filling and redo it. Okay. After the pulp was well, I'm not sure exactly what she meant. After removing that tooth structure, there was a crack. This is important. There was a crack. She put IRM in there, which is a temporary resin material, and told me to wait to see if the pulp would heal itself. Interesting, especially with a crack. That means it's affected and not infected, right? This shows me that Singolina is paying attention and watched some of the other videos and understands that there's affected roots and infected roots, right? It's 5 days now since this happened, and I have had pain every single day. The first days I needed ibuprofen, but now blah blah blah. On we go. My dentist told me if it doesn't get any better, I need a root canal or extract the tooth. Of course, there's your two options again. Would appreciate an answer. Okay, here's your answer. I already think I wrote an answer in there for you, but this is a different situation, Singolina. The problem is not necessarily if the tooth is affected or infected, meaning is the tooth irritated or is it infected and dying? The problem here is that there's a fracture in the tooth, a crack, as your dentist put it. A crack happens when you put either like a mercury filling in the tooth, and a mercury filling expands and contracts 2 to 3 times as much as your tooth does because it's mercury, and mercury has a higher coefficient of expansion than enamel or dentin, or the parts your tooth is made of. So, of course, you put a mercury filling in the tooth, which you didn't have at this point, and it expands and contracts and it cracks the tooth. My hypothesis is that you had a mercury filling in that tooth. A dentist removed the mercury filling and put a composite, a white filling in that tooth, and that white filling, unfortunately, was put into the tooth with a fracture from the previous filling. The other option is that you could have fractured that tooth because the composite filling is too big, weakening the tooth structure. I don't know which one it is because I don't know your situation. But either way, there is a fracture. A fracture, when you put pressure on the fracture, will continue to expand. As the fracture expands, it damages the pulp, it allows bacteria to get into the pulp, it travels along the side of the root, and in general, a fracture that is vertically down the tooth cannot be treated. You can't do a root canal to treat it, you can't put a filling on it to treat it. When there is a vertical fracture in a tooth, and we have ways of testing for it, doesn't sound like they did, but you have certain ways of biting on the tooth to see if it's a fracture or not. And now you have a fractured tooth that's still hurting. The question I would ask you is, does the tooth hurt when you bite down or when you release the bite? Most of the time, a fractured tooth hurts when you bite down and release. Because as you bite down, the fracture separates, and as you release, it pinches the nerve. And that pinching is what hurts. So if the pain is from release of bite, 100% fracture. If the pain is when you bite down, then multiple issues. If the pain is when you bite down and release, fractured and infected. So there you go. In my opinion, I would take a 3D scan. Everybody needs a 3D scan, in my opinion. And I would look at that tooth in 3D, and then I will probably plan for an extraction and a zirconia or ceramic root canal, ceramic implant, or other options. All right, next question. I'm probably going to do just a couple more, and then we'll be done. It says, Doctor, please reply. So why not? Let's do it. Cosmos Red Shift asked, Doctor, please reply. Actually, I have 3 root canals on one side. After that, I'm facing constant head heaviness, sharp shooting, band headaches at 4 a.m., probably from clenching. It's been 4 months. I'm having cough, pain while swallowing, heaviness behind eyes, chronic chest pain on one side, chronic mouth, toothache. My scalp hurts, neck pain, ear pain, everything hurts apparently. My dentist said you have TMJ disorder. He gave me a few exercises and some meds to try to solve that problem. Interesting concept. So here's where history comes in place, right? I would ask you a lot of questions such as, when did it start? Was it before the root canals, after the root canals? Did you have any injuries, falls, TMJ problems before? I would check your TMJ. I would do a 3D cone beam again, a 3D scan of your root canals to see what's going on there. But from what I can see and from what you have told me, I'm going to assume, which we don't like to do, but I'm going to assume that this discomfort happened not too long after the root canals, so that would point towards the root canals. All the pain you are experiencing is not normal. It's probably not just TMJ unless you have TMJ problems, and that's something we can determine just by listening to how your joints sound and how your jaw opens up. So you need probably a second opinion from a dentist. I would of course recommend a biologic dentist who understands TMJ, who takes a 3D cone beam X-ray, who's going to look at your root canals and come up with a solution for you. That would be my goal. I wouldn't take medications and just do some exercises without having checked for those things first. There you go. Okay. Let's see. How much time do I have? It's 12:30, so it's been 30 minutes. I don't even know if you guys are still hearing me, but I wish this chat would work. Let's see. Hello. I'm gonna get better at this one of these days and understand how it actually works. But let's do a couple more questions. If you comment on my videos and you ask you in bold letters and bold letters says question, then I will try to find those bold typings and I will try to answer those questions on the Thursday lives. So any video that I have, find your question, I will try to answer it. Okay, there's hundreds of comments on some of these, so I can't guarantee I will find it, but I will do my absolute best to find it. All right, here we go. Da 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 da. This was all right, let's answer this question. Red alert, free uprising posted. Two of my front teeth have granulomas, so I'm thinking you're meaning fistulas or little bumps on the tissue. Like 4 different dentists spotted them. I've seen them too on X-ray. So if you can see something on an X-ray, it's probably not a soft tissue problem. It's probably going to be something like a lesion around your root, and that's called a periapical lesion or around the apex of the tooth lesion. And they are old. Okay, so just because something has been there for a long time doesn't mean it's okay. On we go. I don't know how old, but on last X-ray they seem to be there. That doesn't help me, unfortunately. I got to get them root canals, I guess. So I guess you don't have root canals on those teeth yet. You have periapical lesions. So number one, I would ask why. Was it an accident? Was it a fall? There are a lot of fillings on these teeth. Is there a cap or a crown? And why would you have those lesions around the root tips? Often, those lesions mean the tooth has been dead for a long time. A dead tooth and a root canal tooth, kind of the same thing, right? Next, I would test those teeth to see if they are dead or alive with an ice or a cold test or different ways of seeing if the tooth responds to being alive or not. If 4 different dentists spotted them, I sure hope that one of them would have tested these teeth to see if they're alive or not. I would like to know if there was pain associated with that, of course, or not. And then I would also check to see if you have any body problems or autoimmune diseases or chronic problems that are getting worse or not going away. Headaches, back pain, like I had, things like that. But from what I can tell, he says you guess you need root canals. You know, we don't have any information on what's actually happening with those teeth. So before you decide on a root canal or removal of a tooth, which on the front tooth, of course, is a little more challenging because you have to deal with not having a tooth, right? I would see somebody who can give you a clear answer. This shouldn't be something you have to decide. You shouldn't leave your dental office having questions like this. A real dentist, a biologic dentist, a dentist who puts you first, who spends time with you, should answer this person face to face, sitting down with you, and give you a clear answer. All right, if you are leaving your practice with these kind of questions for dentists, then you're in the wrong dental practices. Sorry about that. So go do that. Don't make any decision until you see dentists who can give you clarity and find the root cause. Good, good, good. Weston Price Foundation, yep, you should definitely follow them and read what they have to say. Never do root canal, yep. Can't. A lot of people ask where to go in their city, their town, their state, whatever it may be, and it's difficult for me to give clear direction. I have friends in different places, but not everywhere. So we're working on a directory. There's a couple of good people, like some friends of mine, working on a biologic dentist directory. And once that's available, I will post it in the videos. But as for now, I would recommend going to the IAOMT. All right, that's a organization of dentists who are biologic, holistic, biomimetic, the people like me, and they have a directory of people who are members at different levels. So I can't attest for their skill level or their education, but I can attest that they joined this organization to help you. So that would be a good place to start. All right. Just me 907 posted, I've had one root canal in my life on a crowned tooth. That was the absolute worst dental pain in my life. Several years later, the tooth still bothers me and no dentist can explain why. So, very common problem. And I had the same problem with my root canal tooth. Yeah, getting a root canal or having a dead tooth, both are very painful at times. Excuse me. So, a great endodontist can do a root canal for you without pain. I'm not worried about the discomfort of getting a root canal. If you need a root canal and the tooth is dead, that can be some of the most uncomfortable pain you would ever feel. So yeah, a root canal does result in immediate relief usually, and that way you can get a root canal and make a better decision for you based on not having pain. We really can't think or make good decisions when we're in major pain. So I would start with that. Number two, if it still hurts, it's infected. I mean, it's always infected. There's no way to sterilize a root canal. So if it still hurts or bothers you, you have a chronic infection. A chronic infection is terrible for you, okay? Chronic infection is, in my opinion, the root cause of all disease. So you don't want a chronic infection. Have a biologic dentist take a 3D scan of that tooth and give you some options on how to fix it or replace it with something that's not going to create chronic inflammation. If you watch some of the videos, you know that the bacteria in the mouth travel all over the body, okay? And all bacteria in the mouth travel everywhere except, according to endodontists or root canal specialists, the bacteria around root canals stays perfectly put. All right, whatever. So the infections, the bacteria in your mouth that travel everywhere except the ones, of course, around root canals, they stay perfectly put, um, are linked to Alzheimer's, heart disease, cross the placental barrier, cross the blood-brain barrier. I mean, they go everywhere, okay? Stroke related to those bacteria. It's literally slowly going to kill you. So don't keep a chronic infection in your mouth, including infected teeth. On we go. da, 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 da. Okay, you can't reverse a tooth damage if it needs a root canal, unfortunately. A lot of questions are, I have a lot of decay, or I was told I need a root canal, throbbing, aching. I would like to reverse the damage. I wish I could reverse the damage for you, but when the tooth is dead, it's dead. When there's no more blood supply to the organ, it is dead. It's gone. We cannot fix it. If I stop the blood supply to your finger for 2-3 weeks and it was a blue, black, rotten finger, I couldn't fix the finger. It has to come off, and you have to either replace it with a fake finger or leave it off, okay? You don't mummify the finger. I'm not going to go in there and inject formaldehyde and try to sterilize the finger and have this fake looking black finger for the rest of my life that I can't use. It's root canal. You get a mummified tooth that is bacterial laden, it's more fragile, it doesn't have any of the benefits other than chewing. Okay, so I can't reverse a dead tooth yet. All right, my percent chipped. All right, question. Sam Breedy 1632 asked, my right upper incisor was chipped, just a little, when I fell, so I bonded it, so it was bonded. Now, after 7 months, they did a vitality test on my injured tooth and showed no response. Dentist said my tooth is non-vital, which is another way of saying dead, and root canal should be done to avoid infections in future. Fine enamel crack lines can also be seen, but no fracture in X-ray. We'll get to that in a second. Please suggest me the best treatment for my right upper incisor. So just to remember, I am not your dentist for any of these things. You do need to see a dentist to get a true analysis, but my opinion is this. Our second opinion would be, number one, a vitality test is not always accurate. It has a lot to do with the adjacent teeth, number one. Number two, if you don't see fractures on X-rays. If you see a fracture on an X-ray, the tooth is separated. All right, and at that point, it's very obvious, and the tooth would have to come out. There's nothing that can fix that. But these hairline fractures, and those are not visible on X-rays. Fine enamel crack lines, vertical, especially on teeth, totally normal. Over time, excuse me, talking on. Over time, the vertical fracture lines are normal. That's from chewing. Their teeth are made to do that. They're not going to necessarily break from that. So there is no infections on the X-rays, according to them. So 3D scan. You need a 3D scan, not just a regular X-ray. I don't think if you have a small little chip, that the small little chip would be the problem. It's probably from when you fell. You could have hit the tooth and damaged the root. It pushes on the root on the bottom, and sometimes it severs the blood supply. I would look to see if the tooth is in general a little bit darker, which is a sign of a dead tooth, because the blood inside the tooth turns kind of black brownish, and that creates a darker color. Or like a bruise inside the tooth, right? But it can't leave the tooth because it's always there. So you need a better analysis, a 3D scan. If there's no lesion on the X-ray, if there's no pain, then I would leave it. Honestly, I would just leave it. All right, on we go. I have a tooth. Unfortunately, there's not a lot of question there, so I can't answer it. I have a tooth I need to save from root canal. Yes, I would need more details on that. Mark more. Yes, I'm not going to talk about that. Wish I knew this before. No, it's never too late. You can always go and do better. Good. All right, here we go. This is another good question. Lucy Lux. I have a broken molar from an untreated cavity with its nerve exposed. I have no pain even when eating. There is spots of blood when cleaning with a Q-tip in the morning, but not throughout the day. It sounds like my tooth is living. I have reversed the cavity by 30%. Do you suggest I get a crown when the inner cavity is fully reversed, or continue to remineralize the tooth? Please give me your office information, which I think I did. So there's a lot of talk about reversing cavities. A lot of people ask about that question. They use different protocols. But here's the deal. You cannot reverse certain cavities because when it gets into the second layer of the tooth and it's very deep, the dentin, or the soft layer of your tooth, is mostly organic and it becomes mush. The acid, okay, acid is what we call a cavity. Acid dissolves the tooth. That's what the black stuff is. As the acid dissolves the tooth, it turns weak and blackish on the inside. Bacteria live in that area, and then they multiply and they release more acid, and the cavity gets bigger. That's what that really is. You reverse a cavity by killing the bacteria. I do that with ozone water or ozone gas. Then you remineralize that tooth if it can be remineralized, which is mostly the outside layer of the tooth, with the proper pH of your mouth and your saliva. Those are the two most important things. If your saliva is not correct, if your pH in your mouth is not correct, then I don't care if you add miracle juice to your mouth, it's not going to remineralize. I don't care if it's fluoride, hydroxyapatite, micro, nano, it doesn't work, okay? It only works in the right environment. So the environment comes before the remineralization. Kill the bacteria, prevent the bacteria from continuing, meaning change your biome. That's why I invented postbiotics. And then go in there and remineralize. Make sure your pH of your mouth is correct. That has a lot to do with stomach acid and your whole body pH. Make sure you're eating a well-balanced diet. Make sure you have enough saliva. If your saliva is ropey, it's not going to remineralize. If your saliva is too dry, it's not going to remineralize, right? You need to constantly coat the teeth with stuff that can soak into the tooth and rebuild the tooth. It's entirely possible, but the environment is key. So taking just a remineralizing toothpaste is not going to be enough. You have to have good oral hygiene habits. You have to have the right biome, aka pH of your mouth, and you have to have right saliva. All these things a biodentist should talk to you about. By looking at all these advertisements for miracle mouthwash, miracle toothpaste, hydroxyapatite, all these things are pretty much designed to just sell you. It's true. It's ridiculous. Unless you have a protocol that works, don't waste your money. Focus on good oral hygiene and a good diet. That's the best thing you can do. Then you can focus on adding things to remineralize your mouth. Otherwise, it won't work. On we go. We'll do maybe another 2 or 3. I have 3 crowns. I have 3 crowns. This is Alex12V7I. I think if you guys get like an actual name on YouTube, it's gonna be super easy to read. I have 3 crowns on 2 front teeth and 1 next to those, so 3 teeth in a row. I have a bump. Probably have to stop soon so I can actually talk. I have a bump on top of the tooth next to my front tooth on my gum. So it's probably what we call a lateral tooth, a small front tooth. And the bump is something we call a fistula. It does most likely. It doesn't hurt only when I press on my gums. What should I do? So what I would first do is say, hey, there's a fistula or a tract, something is working its way out of the tissue into your mouth. You push on that, you're probably going to get some pus out of there. That might be a good video, right? Just push on and like white pus comes out. We see this all day long. You need a 3D scan, of that tooth. Probably going to have a periapical lesion. I'm drinking water. You're probably going to have a periapical lesion or infection on the root of that tooth, probably due to trauma from the tooth. And then you need to decide if you're going to do root canal or you're going to do an extraction. I think I just did a video on root canal versus extraction, so check that one out there. Okay, I'm going to switch back over here. So obviously my voice is starting to go from talking so much. If you guys have questions again, please go ahead and comment on my videos and type question. And then I will find those questions, and if I don't answer it in the video, which I try to do anyway, I will answer it on the weekly YouTube live on Thursdays. And then hopefully you can get your questions answered, at least as an opinion from a biologic dentist. The whole point is you do need to see a biologic dentist. I am not your dentist. I'm not your treating doctor. And this is not medical advice. This is just an opinion, okay? I hope this was helpful. Please share and like some of the videos and the lives so that we can get a bigger reach on this platform. It's going to help people like you, and I'm able to do these kind of lives and actually make a difference in the world for the health of you guys. Thank you so much, and have an awesome Thursday.